So what's your name?
My name's Kate Nochta.
And Kate, where are you from?
I'm from Pasadena, born and raised in Arizona, moved out here for school and stayed out here for work, and I work at Kaiser Permanente in Downey.
And what do you do at Kaiser?
I'm a physical therapist.
Okay, and how long have you been practicing at Kaiser and then total as a therapist?
Kaiser, I'd say about 3 years, and then total as a therapist 4, so not very long.
Okay, cool. Now you've actually been a patient of Dr. Jacobs, is that correct?
Correct.
Okay, and what was he treating you for?
He's treating me for bilateral knee pain and hip pain, pelvic pain.
Okay, so when you've come into the clinic, can you talk just briefly, if you don't mind, about what your experience has been, because you're a PT.
Right.
Your experience before having taken the class, just, your experience having gone through his program and him treating you with ASTR.
I'd say that it's a completely revolutionary approach. There's no one out there that I know of that currently does it. Now, I haven't been around very long, but I've tried to seek out the best professionals to treat my particular condition. And they're all very good at what they do, but he does something that's so different. And it actually, I had results in the first treatment, whereas before I was looking for results, and they just say, keep trying, but I didn't really get that relief that I was looking for, because he combines multiple modalities to address a patient.
Okay, and how long have you been actually seeing Dr. Jacobs?
Gosh, I haven't really been paying too much attention. I guess maybe 4 months.
Okay.
Yeah.
And what has he been, you're still currently seeing him, so what has he been doing during that entire time?
During that entire time, he uses his manual tools that release fascial restrictions, fibrosis, and scar tissue, which apparently I have a lot of and I wasn't aware of. He does the biopsychosocial approach where he assesses nutritional status, so if your nutrition isn't in line with where it should be, you're not going to heal very well, so you're not going to get the benefits you need from the treatment, that's probably one of the biggest things that he does that I don't see other people do, in combining that. And then stress management, so the psychological aspects as well.
Okay. So you're on day 4. You guys are almost ready to graduate from the institute. What are your thoughts about the class that you've taken with Dr. Jacobs now, that not just having him practice on you, but actually learning from him? If there's like one thing that you have, you're taking away after this class, what is the biggest difference that you've noticed or what you've learned compared to what you've been doing so far in your practice?
The biggest difference, well, there are a lot of things, but the one that kind of sticks out to me right now is I've always done stretching and strengthening and movement analysis, and that's been the biggest part of my practice. And movement analysis is important, but it doesn't address the dysfunction. And you can try to force a person to move a certain way, but if they have a restriction, they're not necessarily going to move that way, no matter how much you try. So learning that, these fascial restrictions, these fibrosis restrictions can affect patient movement has really been a big part of what I learned through Dr. Jacobs. And releasing that, you can see complete changes in functional mobility within the first visit. And then to maintain that mobility, you want to look into nutrition, which I've never implemented personally in my practice and didn't really know I had the ability to, because we talked briefly about it in PT school, but it's not something that's really covered at all, nutrition.
Okay, so with ASTR, that's a great point. Like when you were in school going through your program, that was how many years ago?
4 years ago.
So not that long ago.
Yeah.
How much of what Dr. Jacobs has been covering is something that you actually learned in your classes, and how much time was spent on those different areas? So for example, nutrition, was that something you guys covered in PT school?
I don't recall.
Okay, so
covering
nutrition, okay, that was not. What about, what else is something that you've learned in the class that was not covered in school?
We talked about soft tissue mobilization, but we were primarily focused on joint mobilization. So fascia is a new concept to me. I know it's in the body, and we dissected it, but we didn't really talk about it. Fibrosis and scar tissue. They're you have scar tissue, you have scar tissue, and push through the pain for, say, someone who has a total knee, or you're trying to get that range of motion. That's the common approach, is you want to avoid that scarring, so you got to push through the range of motion. Whereas he's completely, it's not a no pain, no gain mentality. You want to release the adhesions and maintain range of motion, but comfortably.
So the things that he's focusing on were probably very minimally covered, not really focused on, but he's basically saying these are so important to greater long-term outcomes and fast pain relief. Is that correct?
Correct. Yeah, because I even kind of was the no pain, no gain mentality before taking his course to a certain extent. Mm-hmm. But yeah, some things the only way I knew was to push through the pain.
Okay. Now, have you actually had an ASTR treatment since you've been here? Oh, sorry, you've been with Dr. Jacobs.
Oh,
so
yes,
You
correct.
already had treatment.
I've
Forget
had
I asked
treatment,
that.
but I haven't. No, it's okay.
You're fine. Okay, so is there any any notes you want to give to other colleagues? Anything you want to say to them if they're like not sure about signing up for the coursework? What are your thoughts?
My thoughts, because I've talked to a few of my colleagues and they are interested, and they're pretty open-minded about it. But I find a lot have the skepticism about, well, what makes this different than any other instrument-assisted soft tissue mobilization? Like, why reinvent the wheel? It's already been invented. There's nothing new. But you can't really say that without actually truly experiencing it, and just watching the videos can give you a little bit more insight into what he does, because it's not just the instruments, it's the whole approach, looking at the person from a whole.
So a holistic
nutrition,
approach.
holistic, nutrition, psychology. So it's like seeing one practitioner for when you normally see like maybe 6 different practitioners to treat the whole person.
Now, have you seen anybody receive treatments here, like your other colleagues that are here for the class?
That are here for the class,
Yeah.
yes, I have. I've seen them, and within one treatment session, I can't say I've ever experienced this in my time practicing, the amount of significant pain relief within one treatment. Like, usually clinically significant difference is if we get like a 5-degree range of motion change.
Okay, and what have you seen here?
I've seen like full range of motion after one treatment.
Okay, so it's not just on his videos. You have personally seen this
Right,
over the last 4 days. Okay.
right, and has experienced it too as a patient.
Yeah. Awesome. Well, thank you so much. We appreciate it.
All right, thank you.